give to you if not knowledge? As a medical personnel, what I owe you is knowledge. And sometimes we take this simple thing, we take it for granted. Today, I want to talk about or educate the pregnant women about a condition they usually experience. And some of them, they don't actually know why they come down with such condition. And that condition is UTIs. UTIs, that is urinary tract infection. Urinary tract infections. You see, a pregnant woman come to the hospital and tell you, "Oh nurse, I'm having this vaginal discharges that is foul smelling, sometimes itching." And then when you ask them about their perineal care, their personal hygiene, they'll tell you they are really keeping it. And looking at them physically, you know that this one is not, is a woman that is well kept. Now, I want to tell you today that it is not your fault and that it's something that is common in pregnancy. This is because of the pregnancy hormones that act on your body. So pregnant women tend to have this condition, this urinary tract infections. Don't panic. That is why I am here today to talk about it. Another reason that causes it, many people will come and ask, why am I having these issues? Why? Because I keep myself well. But I want to tell you that it is not your fault. Another reason is because of the uterine pressure. That pressure that you are having, sometimes that pressure is on your bladder where the urine is collected. And now, because of that pressure, pregnant women cannot really, some of them cannot really empty their bladder completely. That's why you see pregnant women most of the time, every time you see them going to the restroom, they want to go and ease themselves, they want to go and empty their bladder. Sometimes it's not completely empty. And because of that urine that stays there, sometimes it even goes up and sometimes it stays there for a very long time. Ordinarily, now when something is there overnight, you know what it causes. So that is one reason. That's another reason why a pregnant woman comes down with UTIs. And another reason, again, is the changes in the composition of the urine. A pregnant woman, most of the time, because of the hormones, like I said, they tend to urinate. Their urine has proteins, glucose, like that. And now, because of those compositions, those heavy metals in their urine, they tend to come down with a urinary tract infection. And another reason is because of their immunity. When you're pregnant women immunity is very low. Their immunity is very low. So those things are expected. Now, what can you do? What can you do? What are the things that you can do to actually help you during pregnancy? Drink a lot of water. Drink a lot of water. If you are pregnant, do not compromise. I just see when pregnant women, they come to the clinic, you see them with big water bottle. Please drink it as if your whole life depends on it. You actually need it. And another reason is you should never, another thing you can do to prevent that UTI from occurring is you should never hold back your urine. When you feel like urinating, please go and urinate. A pregnant woman is not supposed to hold her urine for a very long time. You see, ordinarily, we have control over it. But for a pregnant woman is not a good thing to do because you need to empty that bladder often. Another thing is the way you clean up after urinating, after using the restroom. How do you clean up? Some people, because of the shape of their pregnancy, because of the shape of their pregnancy and the length of their pregnancy, they just find it convenient to use their, their, like their tissue in front. They will just go in front. You clean yourself upward, which is very, very wrong for a pregnant woman. Please, as a pregnant woman, try that whenever you use the restroom, you clean from the front to the back and not the other way around. Knowledge is power. Do not ignore this. Thank you.